Dr. Rapor, good morning.
John, as always, you bring a bright day.
So you went into your thesaurus and dug up the word impasse. You're feeling like this mission that we're on is at an impasse. Would you like to elaborate on
I'm glad you didn't ask me to spell it.
that?
Yes, impasse. I've had some poor feelings in the last couple of months that we're not pushing the patients into the right doctors, that the doctors are not changing their attitude, that there seems to be nothing but money on everybody's mind. Let me give you a couple of examples of why I'm feeling badly. And I'm still getting emails from patients suffering terribly and vilifying the care they've been getting from doctors all over the country and Europe. The new president of the Academy of Dermatology sent a note out, or I read it somewhere. His prime concern is compensation. That's number one, number two, number three.
Compensation
for doctors.
For doctors.
No mention about patients. There was something about TSW. There's a bunch of people who are trying to capitalize, and I'll tell you about that in a second, in terms of making money on the term TSW, which I originated. And I therefore sent him a note saying, this has been on the lips and in the readings that I've been getting across my computer. This is a paper that I have written and spent 2 years on, delineating why there is no such thing as bad eczema, that these are all addicted to steroids, and telling you how to take care of it. I really would appreciate if you would look into the paper. He refused to read my paper. Did not want to read my paper. Wouldn't give me the time of day to read my paper.
Not surprising.
Disturbing. Hurt my feelings. There's a group out there comprised of a doctor in Chicago and ITSAN and somebody at NIH who are pushing Dupixent like crazy. The ad for Dupixent is still on the 6 o'clock news on ABC every night. Chubby, heavy-set guy dribbling a basketball and something about Dupixent, good for your skin, you won't itch. It doesn't work. And I can tell the patients, and I've told them repeatedly, I've told the doctors repeatedly, I have seen the patients, they come to me, and I put them on cyclosporin if needed or support. I have seen the emails that they write to me saying, I'm suffering, I've been on Dupixent for 6 months, 12 months, it hasn't worked. The numbers are over 200 failures. I have reported that.
Well, I don't mean to interrupt you, but I think it's far more insidious than that, because there is a specific TikToker that's out there that chronicles their journey and their whole, that was under your care. And they were on cyclosporine under your oversight. And I'm not violating any HIPAA rules here because they're talking about this freely on TikTok as well. But they saw improvement under cyclosporine. They had to discontinue both having you as their physician and the use of cyclosporine because they couldn't afford the drug. And as a result, they're now on Dupixent, and their insurance company's paying for it, and they're not improving.
They're not improving.
So I guess I've become a little cynical to this notion of being at an impasse when people who are familiar with your material, familiar with your body of work, who have been under your care, that say, okay, I can't do it anymore, I've got to go down plan B, and plan B isn't working. So how are you going to, we have this education mission, and the person that you would think would be the most educated turns their back and says, I'm going on Dupixent.
Well,
because I can't afford it.
You and I, before we turned the film on, in the past couple of days have talked about, should I say anything on the tube? And it's time. I've avoided saying I am here to help you if you want my medical advice and help. I'm sorry, but I do charge a fee.
Well,
No, I'm not sorry. I charge a
well,
fee.
and I don't know if that should be a separate video or not. We certainly can do a separate video, but we can touch upon it here. You have been hesitant to directly write prescriptions for people under your care vis-a-vis telemedicine. I apologize if I'm putting words in your mouth, and correct me if I say something wrong. And the onus has been on the patient to find a GP or an internist to actually write prescriptions for not only Dupixent, not Dupixent, God forbid, for not only cyclosporine, but
Support medicines,
Atarax,
anti-itch,
gabapentin,
right.
all that stuff,
Yeah.
right? And that just really adds kind of insult to injury for the patient, because they're now having to sell the notion to their GP or their derm on this notion of topical steroid withdrawal and addiction, and it's falling on deaf ears.
Well,
all that to say that we've discussed this, there is a shift in your practice where you will directly, when it's warranted, issue prescriptions for these care medicines.
Well, okay, and my tack, when you cite that I wanted their local doctor down the street to be on their side also with me, my tack was psychological and support. I want you to have somebody in your neighborhood, in your town, in your city with me, because I'm 3,000 miles
Not gonna
away.
happen. Not going to happen.
And we'll work together for you.
Not going to happen.
Well, that's why I started saying, okay, you're miserable. I don't care. I'm going to write the prescriptions for you.
Okay, so we've laid the
No, I
groundwork.
do care. Therefore, I'm going to write the prescriptions for you.
So that lays the groundwork for my next comment. Dr. Rapaport's contact information is in the description here. And I would heavily advise you to not call Dr. Rapaport to get the history of topical steroid withdrawal, the effects of Dupixent, and all the ancillary issues. Watch the videos. Watch one video, watch 5 videos, watch 10 videos before you make that call, because he's giving that information away. The point of contacting Dr. Rapaport is for your direct evaluation of symptoms, how you're doing, any support medications, and all that sort of thing. You don't need to pay Dr. Rapaport to educate you on because you know what? Just by virtue of you watching these videos, you know more about topical steroid withdrawal than 85% of the dermatological community. So don't waste your call with him rehashing that. Watch the videos, make the call, and have that call be about your personal situation. Have I summarized that adequately?
Yeah, and I have spent a lot of money on this for 43 years in order to make people better. That's my bent. I've always done that. Large amount of money. That film was very expensive, the documentary Skin on Fire. Plus. I feel that I'd like to make, with more time being given, a fee.
Well,
and my fee is
that. You've got insurance that you're paying for, you're maintaining your licenses, you're doing all this stuff.
Of course.
There's overhead, there's an office, there's all this stuff. So that's not an unreasonable request. I just showed you a car repair bill, right?
Yeah. I know. But it makes me feel that there is no money out there in America, or they're unwilling, or I'm not worthy of it. It hurts my feelings too.
Well, it shouldn't hurt your feelings. I think the mindset is that some people just, you have said numerous times in our videos that going cold turkey is an option and not doing any supportive care. And the question ultimately is why? Why would you do that?
I know. Why would you go in a rabbit hole for 5 years?
Well, I think people think that they can tough it out. That's the only reason I can come up with. And there's another person. This isn't the one I was referring to on TikTok. This is another person who's on Dupixent for topical steroid withdrawal for the sole reason they're concerned about the potential blood pressure implications of cyclosporine. And it's like, you're taking a new drug that has no long-term studies.
Yeah.
You're wandering into the darkness.
Nor any good short-term studies of that effectiveness.
I just don't get it.
Well, somebody's whispering in their ear. And we've talked about how the doctors are afraid of a new drug. The drug's been around for 40 years, cyclosporin, and I don't give it to everybody. I'm suspicious that everybody gets Topical who walks into that office, no matter how severe or how minimal their problem is. And that's not appropriate at all. At all.
And for the telemedicine patients, you're still getting bloods. You're still getting blood pressure.
Everything. I'm watching everything. Of course.
So if course corrections have to be made, course corrections have to be made. It's not the end of the
And if
world.
indeed we need a doctor in their city to do something, we figure it out. I've done it over and over and over again. But why are you hiding in a rabbit hole and suffering? There have been several people. I stopped steroids 2 years ago, but I'm still miserable. I say, where were you for 2 years? Why are you miserable?
All right.
Then finally they sign up.
Yeah.
Please help me now. Oh, really? I'm more than happy. Where the hell were you? And it becomes a game of money. And I'm very suspicious that the drug company, after Leo made $700,000.
Well, we're gonna make a different video about that.
Okay.
Yeah.
But there's a push on the Dupixent company to sell more drug, whether they works or not. Doesn't matter. They're getting the money.
Yeah, we're gonna have an absolute standalone presentation on that.
Fine.
So that said, if you are suffering and you are seeking some assistance and you're ready to, give up being a vegan and all that sort of thing, and would like to have the help of Dr. Rapor, watch the videos. Watch some of the videos. We're repetitious, and I think that's a good thing, but contact Dr. Rapor after you've, I should say, girded your loins. Is that an appropriate term?
It sounds like a Tarzan movie.
Okay, well, there you have it. All right, Dr. Rapor, as always, thank you.